My name is Tedros Adhanom. Currently, I'm a minister, a special advisor to the Prime Minister of Ethiopia. I'm formerly a foreign minister and health minister of Ethiopia. What I believe is violence against children is violence against our future. Because everybody knows that children are our future. And when children are abused, it affects their mental, physical well-being, and also affects social structure also. And its effect can be felt in the future because, as I said earlier, children are the future. So I think understanding it to that extent and understanding the gravity of the problem is very important before we talk about the acceleration of the implementation. Because we take things seriously when we understand the gravity. We commit to implementation when we understand how grave the situation is. And then coming to the acceleration of the implementation, the most important thing for me is to have political commitment. Political commitment is key, and it has to be related to the root cause of the problem also. The root cause, for instance, with violence against children is problems related to violating human rights. So let's take violation or violence against children as a human rights violation. That's one. And violence against children cannot be seen in isolation from violence against women and girls. And we need to understand the root cause of that problem, which is gender inequality. So political commitment, especially that identifies gender inequality and also child abuse as violence against human rights, really is very important. So the number one is political commitment. And the second is we need to have a multi-sectoral approach, multi-stakeholder approach, because this is not just for the health sector alone. It covers many other sectors, and all has to be engaged. And the third and even most important is communities should own it. We should make sure that this is not just about the political leadership, but there should be real community ownership. It's when communities understand the gravity, which I said, and the root cause behind it, that we can achieve a palpable and significant progress. Last but not least, preparing the health system will be important to accelerate our action. Strengthening the health system, starting from the governance and also the service delivery. But not only that, the workforce should also be prepared to address this. Do they have the right skills to identify violence and abuse against children and women and girls? And do they have the capacity to prevent it? Do they have the capacity to respond when it happens? And in the health sector also, we need to really have a good information system. Collect information, understand the situation, understand the gaps, and address the gaps based on the findings. So the robust information is very, very important. So these are four issues that are important to summarize. One is political commitment by identifying the root cause of the problem. Then we need to have a multi-sectoral or multi-stakeholder approach. And number third, we need to have really true or genuine ownership by the community. And number four is preparing the health system in a better way to address the challenge. This question, of course, says if the minister seeks your advice. But as former health minister, I will tell you one problem. Even when we are asked for our advice, we shouldn't rush into telling what our perspective is, or rushing, to tell our recommendations or suggestions. We shouldn't do that. I think the first thing should be to really listen. Even when you're asked, it's better to listen. The perspective of the minister himself. How does he understand the situation, his own country's situation, vis-a-vis violence against women, girls, and children? And from his own words also to tell me what they're doing now and what the challenges are as he understands them. And not only that, the solutions from his own perspective to address the gaps they're facing. Then I will be in a position to really understand the situation, and based on my own understanding and the recommendations he's making, then I can give my recommendations. That will have two advantages. One, I will create rapport with the minister, meaning by listening, I will build relationship with the minister, with him or her. The second advantage is my recommendation will depend on the situation that he is describing and the gaps he identifies, and also the support he needs. And then my recommendation could be really tailored to the need of the minister's situation. That will help in addressing the challenges. But as I said earlier, I think when we discuss after listening to him and after creating the rapport, most of the things will really fall in what I said earlier, starting from the political commitment. And the good thing is we have many opportunities as we speak. For instance, for children, he said specifically on children, you have the UN Convention on Child Rights. I think that's an opportunity. And we have the Sustainable Development Goals endorsed on September 2015, another opportunity. And we have the Global Action Plan now, against interpersonal violence against women, children, and girls. So to also discuss with him on the opportunities that we have would be important. But not only that, using these opportunities, some countries have really advanced. They're on a better stage. And instead of reinventing the wheel, it's good to benchmark best practices and then share with ministers. This country, so and so country has done it. So if you want to tailor it to your need, they cannot implement it as is, but based on their situation, they can see what they can learn and implement it. So as ministers, I think instead of rushing to reinventing the wheel, I will advise to see if other countries have done it and learn from them. By the way, as health minister, that's what I did. Ethiopia's health ministry or the health sector is in a better shape now. And I can tell you the reason is because we really learned from as many countries as possible, tailored it to our need, and implemented it. And I even call our health system now a cocktail of best practices of many countries. So that's what I will tell them. So they can do it themselves. They can go have a look what others have done it, and then select the best for them and prepare a kind of cocktail to address not only this particular issue, but other issues that they have. But finally, really to underline, we have to be strong believers of country ownership. When we go to advise or help countries, we shouldn't try to subscribe. We should really first listen. it's lack of listening or poor listening, which is the beginning of misunderstanding and also poor relationship between us. So we should be believers of country ownership and respect countries, listen first, and help them based on their needs. Because at the end of the day, it's the priorities of the countries and commitment of the senior officials of the country to implement those priorities that will bring result. Because ownership leads to commitment, and commitment leads to result. And these are important. And please, let's stop trying to dictate what we think is good for others, because they know what's good for them, but we can help them in filling the gaps that they have.